Mentoring Her Pitchathon, a virtual competition where women entrepreneurs come together to pitch their business ideas to top industry leaders to get their buy-in. Advice and support is scheduled on Saturday, 10th October. This is an online platform designed to facilitate the most important principle in a modern woman's life. Making meaningful connections with other women breaks down barriers of access that girls and women face by creating a powerful network that empowers them to succeed through connections, communication and community in a way that prioritizes their health and safety. Joining us now to talk more on this is Dr. LOLA ADEYEMI, founder and CEO of Mentoring Her. Welcome to Newsday. It's good to have you with us.
Thank you. Good morning.
All right. So let's talk about the role of technology first in the health sector. We're seeing several startups driven by IT. What are the prospects here for effective health delivery?
I mean, the role of technology is phenomenal in the healthcare sector. There's so much that has been done in the healthcare sector. I mean, there's so many innovative things that I've seen from the drones that have been used even close to us, as in Ghana, to move healthcare forward, like during COVID right now, where in Ghana they're using drones to move critical supplies from point A to point B. I think that is innovative and amazing. To other things that we're doing in Nigeria, like I'm a physician and I have a healthcare company, and we're using innovative technology like the Butterfly IQ, which is a mobile healthcare, which is a mobile imaging machine where you can take it. In fact, you can put it in your bag and you can use it to X-ray people's bodies, and I think, and that is phenomenal. Where someone could have to go to trek or have to go drive hours to get imaging done. I can simply have this in rural places that was never possible in the first place. So technology has taken healthcare so far to the more challenging innovative technologies like the IBM Watson that has done so much more and has helped with data analytics and precision medicine and things like that. Google is also is involved in healthcare technology and doing so many amazing things with helping to diagnose cancer faster. And there's so much more of it. So yeah, technology has gone a long way in innovating and improving healthcare.
Well, talking technology, you launched a technology app called Clinic Go-To. Tell us more about that.
Yeah, so Clinic Go-To is still in the works. We launched it, but we're retooling it because what we realized is that a lot of people want to go to the healthcare physician, to the physician, but they don't have access to the physician. And there are a lot of doctors who want to see a fit patient, but they don't have access to the patient easily. And so we're trying to merge that together to create a platform where a doctor can see a patient to make it easier for doctors to see patients in a more conducive environment, because we don't have enough doctors in Nigeria as we speak. We don't have enough healthcare professionals as we speak. So we're trying to make it so that where you have a hospital and you have a hospital and you don't have enough doctors, a doctor that is possibly it's like the ability to co-share hospital facilities, and so that everybody doesn't have to open up a healthcare facility on their own. So a hospital can work in your hospital at any particular time, bring their patients, and a patient can also find the hospital closest to him just by going to the app and going to that clinic. It just seamlessly uses technology to create access to healthcare. That's basically what we're doing.
Very good. Now, when you talk about preventive healthcare in Nigeria, where are we in this country, and are we conforming to international best practice?
Oh no, we are not. Preventive healthcare in Nigeria is starting to come to life because we are a very informative and educative people, but we have ways to go because we don't have the culture of health in Nigeria, like I try to say, right? We do curative health, right? We wait until we're sick or we're dying before we go and see a physician. Preventative health is preventing death, disability, and disease. So, and that's because of the social determinants of health. There's so many factors associated about how you get healthcare, from where you live, to how much money you have. And a lot of people in Nigeria pay out of pocket. So just imagine me telling somebody that you're well, but come and pay me money to see me. They'll think I'm crazy. So it's really hard for the average Nigerian to understand the concept that, hey, if you pay me money to see me when you are well, you're not going to be sick. But we're getting there, right? And so we're not, according to international best practices, we're not practicing in preventative health. But because people are becoming more enlightened, a lot of people, the internet is showing us how important it is to pay attention to your health. Because if you don't make time for your health today, you're going to make time for sickness tomorrow. And so it is important that we do pay attention to our health preventatively. And that's what my organization, Magna Carta Health, is trying to preach. And some people are listening.
And you also empower young women to pursue their dreams. What are your success stories with your social impact company, Mentoring Her?
Thank you for asking. So what we did, or what we've done so far, we started less than a year ago, but what we're doing is giving people access to the female mentors that they've always been looking for, or that they have had little access to. Traditional mentoring is from who do you know or who do you have access to, and that's what we're trying to change. That you don't have to know. I don't have to know you. I don't have to know Mr. Anduka Obiegano. I just need to know. I just need to be on this platform to be able to find somebody who can help me meet or match the kind of person that I want to be. I want to be a journalist, for instance. How do I start? I'm a young woman. And how do I start? Do I have to go start knocking on doors, or do I have to be best friends with somebody who's a journalist? No. All you have to do is to come to this platform, apply, and what you then do is, if you meet the criteria of the kind of people we're looking for, meaning that we do some type of background check on you, but the point is, once you're applied, we do a matching quiz, and we use an algorithm to match you with the kind of person that suits the needs that you want. And once we do that, you will be matched with somebody that can help you level up, so to speak, right? And so you don't have to know that person from Adam. You don't have to be introduced to the person through a computer. And the person has willingly said that, hey, I'm here to help. I want to help another woman become a better version of themselves. And I think that's the beauty of it, that we've had people say, hey, I've had somebody, this is somebody in the US, she's in an Ivy League school. She said, she had an interesting conversation with a young woman who wants to come get into school, an Ivy League school. So those are the success stories where I can connect a woman in the US with a woman in another country, and that they would never have had access to one another before, to get, hey, how do I get into an Ivy League school like yours? And she's just, coaching her and telling her that this is what you need to do, and this is how you're going to do it. And give her that hope and the ability that she can do it. And other success stories, another person said, hey, somebody was trying to get a job, or somebody got a job, and she's like, she's coming there, she doesn't know anybody, and, like, I work in the same institution. This is who you need to know. This is how, so we've matched other people. Another person said she met somebody there. She's in Nigeria, and she met somebody abroad as well. And she's trying to do something career-wise, and she's given her so many resources. She was overwhelmed, and it's all for free. That's the beauty of it. It's all for free. So there's so many opportunities that you can get just by being able to connect with somebody who is really willing to help you. And so that's the beauty of it.
In these contemporary efforts, no doubt. But let's go back in retrospect. There's much talk about empowering women, as you've alluded to, in Nigeria. But how would you assess efforts made so far? Not just people like yourself coming from the private sector, but government's role in this as well. What do you make of it?
I think the government is trying. I think that's a great question. If you ask me, but I think it should be more strategic, because when you do something, you need to be able to measure it, right? I don't know the metrics they're using to measure. And I think that's what the challenge is, because if you can't measure what you're doing, then you don't know how successful you are. And so I know they have initiatives. I mean, I can't count them on the tip of my hands, but I know the government does have some initiatives for women. Especially in Lagos State, and I'm sure they have in other states as well. But I think the truth is, how successful are they, and how impactful have they been, and how have they strategically planned it so that it will be beneficial? And I think it goes back to planning and making sure that whatever you're doing is for the right reasons, right? And it gives you the right outcome. So if you have to, it starts with planning properly to make sure you get the right outcomes. And it's interesting that you asked that, because a lot of people say, hey, I want to do this, right? But they don't, you have to start from the end, right? You start that, what are the outcomes that I'm trying to achieve? And then you plan on how you're going to do it. So I think maybe that's part of the problem. And that's why it's hard to concretely ask the average woman on the streets that, oh, what has the government done to empower you? I know they have some small and medium enterprise things. I know they have some things for market women. I know they have some things for domestic violence abuse. But what if I don't fall in those categories, right? How have they impacted me? I can't necessarily say that they have. I know they have something for women and children in the healthcare sector. But that's a really good question that I think that the government should really pay attention to and try to answer. I know the First Lady does things, but it's not about a First Lady issue. It's a government issue. So I think there's a lot more that the government can do, and they can learn from other governments that are actually doing a lot.
Well, you also mentor for the Johns Hopkins University and Harvard University. I would like to know how impactful that has been.
There's something called reverse mentoring, right? When we believe that, mentors give a lot of their time, and we actually do, but that has really been impactful for me, because it's one thing for me to say, hey, I mentor this person. I spend a lot of my time talking to people, via Zoom or have a coffee before COVID and things like that, and just tell them that, hey, it's been really impactful, I believe, for my mentees. I do it regularly, but I think for me as a person, it has enriched my life, that I can say that I'm this person's success story one way or the other. And that's all I get for it, right? And I learn new things because, I have an 18-year-old mentee who has taught me so many things that I didn't know, and not things in like the social media, but she's not even on social media. It's just has taught me so much brilliance and resilience in a young lady, and what she wants to do and what she wants to be. It's so exciting, and how she rubs minds with me and things like that. So it teaches, it's been impactful for them, but it's been tremendously impactful and rewarding for me. And I think, and that's about reverse mentoring, and how you as a mentor can also get a lot of benefit from being a mentor. It's impactful for me, yeah.
Very good. Well, very briefly, I'd like your thoughts on the issue of health insurance in this country. And of course, that hasn't had much headlines recently. So what are your thoughts here? What should be done to encourage more participation, as it were?
Yeah, health insurance has a long way to go in Nigeria, a long way to go. Unfortunately, it's the purchasing power of the people, right? For you to be able to, first of all, you have to understand health insurance. I think that's part of the problem, right? A lot of people do not understand health insurance. So I think we need to do a better job on letting people understand what health insurance is, number one. And I don't think the government has done that successfully. They haven't done that. If people don't know what they're putting their money into, no matter how small it is, they're not going to want to do it. And they're not going to trust you to use their money to say that, okay, give me a little bit of money so that when you're sick, you don't have to pay a lot of money. People don't understand that concept, right? So we're not educating people enough about it. And then even the process of health insurance, it's not as seamless as it should be, because I am a provider. I work with NHIS, et cetera, et cetera. I know the process. It's not that seamless, right? And even the Lagos State Health Insurance that I'm involved in as well, that is actually good. And I think it's
That's
beneficial.
the much we can take now, Dr. LOLA ADEYEMI, but I wouldn't let you go without mentioning that you're this year's recipient of the Global Achievement Award from the Johns Hopkins University. Congratulations to you. Thank you for joining us on Newsday.